Loestrin Fe is a combination hormone medication that is used to prevent pregnancy. It contains two hormones, norethindrone and ethinyl estradiol. This product also includes a small amount of iron in inactive tablets taken during the 4th week. The inactive pills are not meant to contain any hormones and are just there to help you stay in the habit of taking one tablet each day. However, they do not have enough iron to treat iron deficiency. In addition to preventing pregnancy, birth control pills may make your periods more regular, decrease blood loss and painful periods, decrease the risk of ovarian cysts, and also treat acne. It is important to note that using this medication does not protect you or your partner against sexually transmitted diseases. As for the best time to take this medication, it is recommended to take one tablet at the same time every day, with or without food. Before starting Loestrin Fe, make sure to read the patient information leaflet provided by your pharmacist. This leaflet contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. It's important to pick a time of day that is easy for you to remember, and take your pill at the same time each day. Continue taking this medication exactly as prescribed by your doctor. Follow the package instructions to find the first tablet, start with the first tablet in the pack, and take them in the correct order. Do not skip any doses. If you experience vomiting or diarrhea within 3 to 4 hours after taking your tablet, follow the instructions in the patient information leaflet section titled, "What to Do If You Miss Tablets." You can choose to take this medication after your evening meal or at bedtime if you have stomach upset or nausea. No matter what dosing schedule you use, it's important to take this medication at the same time each day, 24 hours apart. Your pill pack contains 26 pills with active medication and 2 reminder pills with iron. Take one active pill once daily for 26 days in a row, followed by one reminder pill once daily for 2 days in a row unless otherwise directed by your doctor. You should have your period during the 4th week of the cycle. If you are taking certain medications that can interact with iron, ask your doctor whether you should throw away the reminder pills each day rather than taking them. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Ask your doctor or pharmacist for information about how to switch from other forms of hormonal birth control to this product. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Some common side effects of Loestrin Fe include nausea, vomiting, headache, abdominal cramps, breast tenderness, and swelling of the ankles or feet. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. Additionally, if you miss 2 periods in a row, or 1 period if the pill has not been used properly, it's important to contact your doctor for a pregnancy test. It's important to note that this medication has been prescribed because your doctor has determined that the benefits to you outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. Loestrin Fe may also raise your blood pressure. It's important to regularly check your blood pressure and inform your doctor if the results are high. Contact your doctor right away if you experience any serious side effects, such as a lump in your breast, changes in mood or mental health, unusual changes in vaginal bleeding, dark urine, severe stomach or abdominal pain, or yellowing of the eyes or skin. In rare cases, this medication may cause serious, sometimes fatal, problems from blood clots. Seek medical help immediately if you experience symptoms such as shortness of breath, chest pain, unusual sweating, confusion, sudden dizziness or fainting, pain/swelling/warmth in the groin or calf, sudden/severe headaches, trouble speaking, weakness on one side of the body, or sudden changes in vision. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, it's important to contact your doctor or pharmacist for further guidance on handling potential side effects. If you're over 35 and smoke, it's not safe to use low Loestrin Fe because it increases the risk of serious health problems. Also, keep the medication out of reach of children to prevent accidental overdose, as it can be fatal. If overdose occurs, seek medical help immediately or call a poison control center. Before starting low Loestrin Fe, it's important to discuss any allergies you may have with your doctor or pharmacist. Also, be sure to disclose your medical history, especially if you have a history of blood clots, high blood pressure, cancer, diabetes, heart problems, liver or kidney disease, thyroid problems, or if you are nearsighted or wear contact lenses. If you have diabetes, it's important to monitor your blood sugar regularly and inform your doctor if you experience symptoms of high blood sugar. If you have or will be having surgery, or if you will be confined to a bed or chair for a long time, be sure to talk to your doctor about any special precautions you need to take while using low Loestrin Fe. This medication may cause dark areas on your face and skin, so it's important to limit your time in the sun and protect your skin with sunscreen and protective clothing. If you wear contact lenses, you may develop vision problems, so be sure to contact your eye doctor if this occurs. It's important to note that it may take longer for you to become pregnant after stopping low Loestrin Fe, and this medication should not be used during pregnancy. Additionally, it may decrease breast milk production, so consult your doctor before breastfeeding. When taking low Loestrin Fe, it's important to be aware of potential drug interactions that could affect the effectiveness of your birth control. Some medications, such as aromatase inhibitors, tamoxifen, and certain drugs used to treat chronic hepatitis C, may interact with low Loestrin Fe, potentially reducing its effectiveness and increasing the risk of pregnancy. It's important to inform your doctor about all the medications and herbal products you are currently using. Additionally, some drugs, such as griseofulvin, rifamycins, and drugs used to treat seizures, may also decrease the amount of birth control hormones in your body, leading to a potential decrease in effectiveness. If you start any new medication, be sure to discuss with your doctor whether you should use additional reliable birth control. It's also important to inform your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working effectively. Furthermore, low Loestrin Fe may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are taking this medication. If you or someone else has taken too much low Loestrin Fe and are experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the Poison Control Center at 1-800-222-1222, while in Canada, you can reach out to your provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important to remember not to share low Loestrin Fe with others. It's recommended to schedule regular physical exams and medical tests, like checking your blood pressure and having a breast and pelvic exam, while you're taking this medication. Your doctor will also give you instructions for examining your breasts, and it's important to report any lumps right away. Make sure to keep all of your medical and lab appointments and consult your doctor for more details. If you miss a dose of low Loestrin Fe, refer to the product package information for advice on what to do. You may need to use backup birth control to prevent pregnancy. If you often forget to take your pills, contact your doctor to discuss switching to another form of birth control. When it comes to storing low Loestrin Fe, it's important to keep it at room temperature and away from light and moisture. Remember not to store it in the bathroom, and always keep it out of reach of children and pets. If you no longer need low Loestrin Fe or it has expired, it's important to properly dispose of it. Instead of flushing it down the toilet or pouring it into the drain, consult with your pharmacist or local waste disposal company for the best way to get rid of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.